Hi, all you fabulous moms out there. Today, let's talk about nipple shields. Let's talk about when you would use it. Let's talk about how to apply it properly, and then some of the risks that come along with using a nipple shield. First off, you would use a nipple shield for the moms who have flat nipples or inverted nipples. It's a very helpful tool for those moms. It also can be used for the mom who's having a lot of nipple pain. Those moms would use it to be a barrier and allow her nipple to heal while you're working on getting the baby to latch properly and to latch deeper. Okay, let's apply the nipple shield. So this nipple shield here, just a silicone nipple shield, you'll see that there's a notched out portion of it compared to the rest of it. It's kind of like a sombrero. This notched out portion, this is where you'd want to aim the baby's nose. So the baby's nose would be touching mom's breast. I like to get it wet first, so the water helps with the suction. Then with your breast, I like to hand express, get a drop of milk, and just coat the outside of this nipple shield with mom's milk. And then usually with two hands, you're going to want to flip your nipple shield almost inside out. Try not to touch the tip of the nipple where you just put the milk. And then right over the nipple, you're going to apply this, and it kind of just pops into place. Okay, the water helps it stay suctioned onto mom's skin. Okay, so you've got your nipple shield here. You're aiming the baby so the baby's nose is able to touch mom's skin right here. The mom who has flat or inverted nipples, same thing. Get it wet. Get milk on the tip of this. You're going to do the same thing. Flip it inside out. And then mom's nipples, let's say, are really inverted. So nothing for baby to grab onto. This nipple shield can be a really nice tool to provide perky nipples for her. So you're applying it the same way. Pop it out. Baby's nose is aimed up here where there's the notched out section, so baby's nose can touch mom's skin. Okay, so then look at this. Look at why there would be some risks involved with using this nipple shield. So first off, we have now created a barrier. Baby is not touching mom's nipple directly. This piece of silicone is blocking that. In the beginning, we know milk production comes from hormones. So the hormone activation is blocked by this silicone piece where baby is latched onto this and having no direct stimulation on mom's nipple. We know we need that to create the hormone release that goes right up to mom's brain to tell her body to make milk. So right now we've blocked that direct hormone connection. Then also look at it. This thing is perky. I can say I've never seen a woman with nipples this big, this perky, nor is it this stiff. Sometimes we like that it's stiff, especially with preemie babies. They need this bit of stiffness to activate their suck reflex. But a baby has to work really hard. I'm going to put this on quickly. A baby has to work really hard with this nipple shield. The baby's going to work hard to pull the milk through the breast that has to come out her nipple and now out this ultra perky nipple shield, which many babies don't have that much energy. They don't have that much stamina to completely drain mom's breast. So if you think about the numbers, you have 100% milk supply. Whether your supply is large or small, doesn't matter, but you have all your milk in your breast, and now with this nipple shield, your baby can maybe potentially pull out, let's say 75%. That means your baby leaves 25% in the breast, and if we leave 25% in the breast each time, your body's going to say, wait a minute, I'm giving you a full milk supply. Why are you leaving leftover milk? And your body says, well, I guess if you don't need it, I'm going to lessen my supply for you. So you're leaving leftover milk. It's sending the message to your brain, you don't need it, and your body over the course of time. Sometimes it takes days, sometimes it takes weeks. Your milk supply drops because you're leaving milk left over. So what do we need to do? You got it. We got to pump. A mom needs to pump each time after breastfeeding with this nipple shield. Then she completely empties her breast, 100% empty, and her body says, okay, let's do it. Let's fill it up again. Your body makes much better milk in empty breasts. Think about your gas tank in your car. When your gas tank is empty, you fill it back up. Most people don't fill up their gas tank every time it just gets half empty. Most of us wait till it's very empty, and then you fill up your gas tank. Your breasts are the same way. Your body makes really good milk when it's 100% empty, and then you get a full milk supply. Your body doesn't know what to do if you leave leftover milk in there each time. It will stop making that much milk, and your milk supply drops. So you've got to pump to keep your milk supply going. So nipple shields can be a helpful tool, but they come with some caution. Make sure you're pumping after so that you keep up a nice, healthy milk supply.